Hello everyone, I'm Dr. Divya Raghavan. I'm a doctor of physical therapy, and today I'm going to show you some simple stretches to help make your knee feel better. So the first stretch is to stretch the muscles in the front of the thigh, known as your quadriceps muscles. These muscles are really important for people who do running, hiking, or even walking long distances. And I usually recommend my patients with knee pain to do these stretches before they go on a run or a hike, and also do it after they're done with their activity. So go ahead and do it along with me. So in a standing position, you're gonna do a pelvic tilt, so tuck in your pelvis. Go ahead and lift your foot up and try to touch the heel to the buttock. The important thing to remember here is to not let your low back arch. So that's why keeping that pelvis tucked in is important. And the other thing is to make sure that the knee stays in line with the other knee or slightly behind it. What I'm trying to say is avoid pulling the knee forward. And now hold the stretch. Try to hold this for at least 30 seconds. Once you're done with one side, go ahead and do it on the other side. Now, while doing the stretch, if you feel any pain in the back of the knee, I would not recommend doing a stretch. The stretch sensation should be felt in the front of the thigh. Also, if you feel any joint pain, like deep pain in the knee joint, again, not a good stretch for you to do. The second stretch is for the muscle, which is the hamstring, the back of the thigh. So for this one, you will need a chair. I'm going to use my bench here to do it. Go ahead and place one leg on the bench, the heel. Keep the body straight, lean forward so that you feel a stretch in the back of your thigh. Now in here, you have to ensure that the knee stays as straight as possible. For some people, the knee hyperextends, like they can really make their knee straight, almost so that, they're forming an angle here. I would say avoid that. As long as the knee comes to like a 0 degree, that should be good. And the other thing is to keep your spine elongated and lean forward. Try not to slouch, or try not to rotate, or no need to even try to touch your toes. It's just about hinging forward so that you feel a slight stretch. Once you feel the stretch, hold it for 30 seconds. In that 30 seconds, if you feel that your muscles has given up a little bit, there's a little bit more slack, you can bend forward a little bit more to continue feeling that same amount of stretch. After 30 seconds, pull this leg down and do the stretch on the other side. The third stretch is for the muscle, which is the calf muscle. The calf is like the most important muscle of the leg. It's like the powerhouse of the leg. So again, for people who run or do CrossFit, HIIT training, where it involves a lot of jumping, people who do dancing, gymnasts will really benefit from the calf stretch. So to do the calf stretch, you have to have your hands on the wall like that. The forward foot, the heel should be down, as well as in the back foot, the heel should be down. I see a lot of patients turning their leg like that. I would say keep it straight and then maintain the stretch. You should feel the stretch in the back of the calf, like over here. Do the stretch two ways. So this is to stretch your gastrocnemius muscle, which is the big bulky muscle on the top of the calf. To stretch your soleus muscle, which is a smaller muscle in the lower part of the calf, bring that back foot forward, bend the back knee, and then feel a stretch in the lower part, which is your soleus muscle. And hold both of these stretches for 30 seconds each, and now switch and do it on the other side. I hope you all enjoyed doing these stretches. If you have any questions for me when you're doing these stretches, feel free to leave a question in the comments below.